Okay, everyone, I think we will go ahead and get started. It is a little after noon Montana time. I want to thank everyone for spending your lunch hour with us today. We really do appreciate your time. My name is Kelly McDermott, and I will be facilitating today. On behalf of Big Sky Care Connect, Montana's premier health information exchange, I would like to welcome you to our monthly webinar series. Before we get started, I would just like to remind everyone to please stay muted unless you are speaking. We welcome your questions throughout the presentation. We have staff that are monitoring the chat box for these questions, and we'll pause after each speaker. And you are welcome then to unmute and ask your questions if you would like. Also, we are recording this presentation, and that recording will be made available in the next few days. We'll send out that link. We are very excited today to present the topic of navigating emergencies with the Health Information Exchange. We have a great lineup of speakers with us today to share information about emergency responses and the importance of the HIE during them. We have a demonstration of the collective medical that will be part of the Big Sky Care Connect platform, and we will hear from a Montana healthcare systems user of that system. So very exciting. As I mentioned, our agenda for today includes 3 speakers. First, we have Chris Huckabee. She'll be discussing the importance of information in an emergency. Chris is a nurse practitioner and senior consultant with Health Tech Solutions, working as a subject matter expert with Big Sky Care Connect. Chris has been on the front lines working with patients during this pandemic, so she has a lot of good information to share. We will then see a demonstration of collective medical from the collective medical team, and this will be followed by Holly Timmons, sharing her experience as a collective medical user. Holly Timmons is a community health investment coordinator for the Washington, Montana region of Providence St. Joseph Health. She is based at Providence St. Patrick Hospital in Missoula and participates for the hospital in collaborative work to reduce homelessness and housing instability, which are strategic priorities for improving the health of the Missoula community. So with that, we will go ahead and get started, and I will turn this over to Chris.
Thank you, Kelly. Hey, good afternoon, everyone. And again, thank you for joining us during your lunch hour. Today, I will be talking to you about emergency management and how Big Sky Care Connect Health Information Exchange can assist in obtaining that critical information when it's needed the most. Emergency situations in this discussion can be defined as any given situation that warrants a collective urgent response from a community and/or a healthcare community. This can include natural disasters, and although Montana is one of the safest states when it comes to natural disasters, you could still be at the mercy of wildfires, earthquake, localized flooding, tornadoes, or winter storms. A lot of these types of situations can displace individuals and amplify the situations where first responders are faced with treating folks with life-threatening injuries or illnesses, all when time is of the essence. We can include the current pandemic that we find ourselves in, COVID-19. So on the radar in healthcare is identifying gaps. We hear this quite frequently. And what types of gaps in care could first responders experience when treating patients in one of these emergency situations? The potential lack of information about an individual's current health status during a natural disaster or crisis has been an important driver for the adoption of health information technology and health information exchange. So why is this the case? Where does the issue lie? So basic lack of information needed to treat an individual increases the risk to that patient, even more so if the patient cannot tell you their medical history. And remember that time is of the essence during these types of situations. Oftentimes, this is the first and the only time that the medical team will touch these individuals. Displaced individuals are at a greater risk of receiving inappropriate treatment due to lack of communicated medical history or that longitudinal health record. This is compounded by the likelihood of the individual being unconscious. They may be injured and unconscious, or they simply cannot communicate effectively during this crisis. Individuals could be transported to a field hospital if one of those had been set up, or a designated site based on their current health status, and this oftentimes is outside of their normal care network. So what is the solution? One of the solutions is Big Sky Care Connect Health Information Exchange. The opportunities for leveraging Big Sky Care Connect functionalities in support of emergency management encompasses daily emergency operations throughout the phases of disaster and emergency preparedness, response, and recovery. Having access to the individual longitudinal record, including that allergy list, that medication list, the problem list, will improve the quality and the continuity of care during these adverse circumstances. Big Sky Care Connect will serve as that source of truth with access to critical patient data by collecting this data across various healthcare sectors. This collection of data can assist in coordinating interventions during these emergency situations to include the natural disasters, communicable diseases, and being a part of the emergency response plan. So what is the function and the purpose of Big Sky Care Connect during an emergency? So the authorized end user providers, which includes and should include EMS providers, can access Big Sky Care Connect to obtain current individual health status during emergency situations. Can also assist those providers that are outside of the individual's normal care team in making informed treatment decisions, which can minimize the risk of gaps in care and the individual experiencing adverse events. Big Sky Care Connect can also assist in that predictive analytics to identify emerging patterns such as clusters of a set of symptoms within a community, hospital, or health system, and can assist public health reporting, and it can pertain to the COVID-19 as well. So what should be a consideration with a connection to Big Sky Care Connect? Well, there's no fees outside of the participation fee. Access to that longitudinal patient record is part of the normal function of an HIE. It would enable participating Montana providers and the public health agencies to mutually benefit from interoperability and data sharing. Would also support the efforts of the Department of Public Health and Human Services to detect and analyze trends related to disease outbreak, and contain the data used in the identifying and tracking of disease clusters in the initial stages to allow for early mobilization of rapid response teams. As with most things, there are dependencies to consider. Access is a very important dependency. Although nearly all technical functionality needed is either existing or planned, there may be a need to set up, for example, a virtual private network or VPN to allow providers to access their own system or portal, particularly if those providers need to obtain access at a temporary field site that has been set up. There may be a need to collect those run sheets, data from EMS systems for analysis and reporting to NEMSIS, which is the national database used by the National Highway Traffic Safety Administration. We will want to keep in mind that the more participants that are contributing data, the more data return in a patient search for a more complete record. And the foreknowledge of special handling of an individual patient. Now, this is critical, say in the case of COVID. The receiving hospital would benefit from the foreknowledge of a COVID patient arriving either by ambulance or private vehicle so that they can prepare for the arrival. This can be done through Big Sky Care Connect. This use case enables more effective emergency management and strengthens the public health infrastructure through the use of Big Sky Care Connect. A real-time accessible system can completely transform the readiness for Montana. So what configuration or interfaces are required? As mentioned before, there's no additional new interfaces that will be required. It's either existing or planned for the system. Big Sky Care Connect has a disaster recovery site. This is for the solution, which is configured as part of the system stand-up activities. This is a disaster recovery related to the solution itself. So some of the points that were recommended as part of the implementation of this emergency management use case included the EMS integration should be a goal. Understanding that it may take time to establish real-time connectivity in the field. For natural disasters taking place in rural Montana, temporary sites can reduce the time EMS spends transporting and treating patients, increasing their presence at their rescue site or ground zero, if you will. The run reports that were mentioned earlier, this is the information gathered on the individual patient by first responders. These can either be pre-printed forms, but they can also be electronic. And this is what would be given to the receiving emergency department upon arrival. These can be managed as they have been in the past, or they can be routed through Big Sky Care Connect to the emergency department, a provider, state and local agencies, NEMSIS, or other interested parties as the need arises. And speaking of NEMSIS, which was also mentioned earlier, this is a national effort to standardize data collected by EMS. It provides a framework collecting, storing, and sharing data from states nationwide. This uniform data set and national EMS database helps local, state, and national EMS stakeholders more accurately assess needs and performance and support strategic planning for mobilization of EMS systems during a time of crisis, such as national disasters and pandemics. There's also the Patient Unified Lookup System for Emergencies, otherwise known as PULSE. This is a network of networks model specifically for emergencies. It utilizes the subscribing jurisdictions credentialed volunteer database to provide easy access and provides the data from all the connected HIEs. So this is particularly useful given that HIEs tend to be state, regional, and in their patient representations. So receiving jurisdictions could receive patients from several states away, and PULSE can provide vital information if the originating jurisdiction has a participating HIE or other such mechanism to provide that data to PULSE. PULSE is listed as a possible key actor along with Nemesis for this use case, and PULSE is part of the Sequoia project first developed in 2014 and 15. PULSE was deployed during the 2017 and 19 California wildfire seasons, and it was also deployed in responding to COVID-19. PULSE Enterprise intends for nationwide scalability is scheduled for release in June 2023. So what we've done here is given you, we pulled out 3 use cases that were user stories that were part of this use case. We've got a clinic, private practice, and hospital. So this first one here, the clinic. So there's a measles outbreak in Dr. Jones's community. Dr. Jones is a physician at an urgent treatment center, which has been tasked as a triage and testing center during the regional alert or public health emergency. The clinic is experiencing increased walk-ins with patients that Dr. Jones has never treated before? Well, Dr. Jones and the clinic are participants with Big Sky Care Connect HIE. And so Dr. Jones just queries Big Sky Care Connect from her electronic health record via single sign-on and accesses patient information as she's treating them. And she has access to medication list, allergies, problem list, advanced directives if there's one available, and other relevant information. Utilizing Big Sky Care Connect during this public health emergency allows Dr. Jones to save time, make well-informed care decisions, and send patients to the appropriate level of care quickly and efficiently. Additionally, the data she contributes can be used to inform syndromic surveillance, disease tracking, and other public health reporting. So the next user story is a primary care physician. So Dr. Smith is a primary care physician who is part of a large hospital system in Montana. He sees Mr. Jeffrey as a regular patient and who is a 70-year-old lung cancer survivor and has recently returned from vacation in Europe. Mr. Jeffrey is experiencing an acute onset of dry cough and fever. Now, as mentioned, Dr. Smith normally cares for Mr. Jeffrey and flags him as vulnerable to the effect of respiratory illnesses due to his past medical history and someone who is likely exposed to COVID. Lab tests and x-rays are ordered. So the test results do confirm Mr. Jeffrey as positive for COVID. He is contagious, and on the physical exam shows he is in acute distress. Dr. Smith orders that Mr. Jeffrey be admitted to the hospital. So Big Sky Care Connect will enable Dr. Smith to keep a pulse on Mr. Jeffrey's status throughout the hospital stay and can monitor his labs and other tests that may be ordered through the hospital. Big Sky Care Connect will promote the sharing of data between Mr. Jeffrey's care team and the Department for Public Health and Human Services to facilitate syndromic surveillance, disease tracking, and monitoring of COVID. And finally, we have a hospital. So the hospital is busy caring for patients after a tornado passed through the community or an earthquake happened. You can fill in the gap there. The hospital adapted their triage protocols to efficiently evaluate the influx of patients. The hospital is a participant in Big Sky Care Connect, HIE, and the emergency department was able to exchange information with EMS team and other disaster volunteers as they evaluated patients at ground zero. This enabled care teams to prepare in advance for the arrival of many patients, effectively triage, test ordered much quicker than if the flow of information was not available. Also, non-emergent patients could be rerouted to an alternate site. Providers were able to utilize Big Sky Care Connect to better navigate the high number of patients seeking emergency care after this natural disaster. Utilizing Big Sky Care Connect as part of an emergency management plan helps to ensure efficient and effective treatment and facilitate coordination with primary care teams for follow-up care. That brings me to the end of my discussion. So if there are any questions, and if there's not any, that's wonderful. We'll go ahead and turn it over to, do I give it back to you, Kelly, or do we go to Collective Medical?
We can go on to Collective Medical for their demonstration.
All right.
Hey, Chris, I'm glad that Collective could follow that great presentation. My name is Rachel from Collective Medical. It's very nice to chat with all of you today on how the ED module fits into the story that Chris was just sharing, really looking at the patient experience from all of the interactions with care team members across the community. I'm now going to show my screen here, so give me just 1 second. Let me know when you can see my slides. I'm not going to do a lot of slides, but just to level set a little bit.
We can see it, Rachel.
Great. Okay. So collective medical is, and I would also be happy to turn on my video here so y'all can get to know me a little better. Hi. Collective medical is working closely with Big Sky Care Connect, and we provision the ED module to the emergency rooms inside of their EMR. We do that using our integration solution called Edu, is what you'll hear it called by the folks from St. Pat's that are on the phone today, and they've been using the system for a long time. It's pretty simple, very lightweight, and intended to really help the emergency room provider have a very quick, short, succinct, and action-oriented summary of what they might need to know about a patient before they arrived at the emergency room door. We're going to grab some demographic information from the Big Sky Care Connect network and your hospitals, and we're going to populate that right back into your EMR within about a minute or two, actually, and I'll show you that. And then the document that we actually send back into the EMR lives there as a document that can be reviewed as the patient is being evaluated by ED case management. Collective Medical is a national vendor, so just to give you a little bit of our footprint, we partner with a lot of HIEs around the country, but we actually are connected to hospitals all across the US. So as we think about the data that's being brought back to the emergency rooms, it is the Big Sky Care Connect network, as well as any hospitals that are out across Oregon, California, Virginia, New Mexico. And this is actually an image of the movement of patients that are experiencing COVID-19 on the collective network, which is just one really obviously relevant example of how this data is so important to help support care coordination. So why does an Edu report, why is it so successful? It's because we only send them for a good reason. So we're really intentional about when that alert goes off in your EMR. It's very actionable, so it really is succinct and designed for an emergency room treating provider, usually used during triage and assessment, sometimes just in those seconds before they actually even introduce themselves to the patient. And it should be consumable within about 60 seconds inside of the ED provider's workflow. That's very important to how we provision the solution. There are primarily 6 categories for which an Edu report will be sent into your EMR or to a nurse's station or the station inside of the emergency room. If you have a fax or printer, we send them there as well if that's more appropriate to your workflow. High utilization is usually the one right out of the box. So anytime a patient has been to had 5 or more ED visits somewhere on the collective network in the last 12 months. If an individual patient has arrived at your emergency room and they've actually been to 3 different sites in the last 90 days, we call that the traveling or rising risk population, where they clearly don't have a good established relationship with a PCP or case management services. If they are working with case management in the community and they have a care guideline in our system, and I'll show you what that looks like. If they have a history of aggressive behavior towards other emergency room staff, we want to make sure that no matter what, your workforce are very safe. And so communicating those events that have recently occurred in other emergency rooms can be very helpful for supporting your efforts to decrease aggressive behavior towards staff and activate your security folks to come and assist. In states that we work where we have partnerships with the state PDMP, we also bring in any history of prescription drug monitoring from the state in which you work. Today, this is not turned on in Montana, but we continue to engage with your state PDMP folks. And then we also can do things like notify for things like history of sepsis or history of COVID-19, which I just mentioned. I'm now going to jump forward to actually show you what this looks like. So, Holly from St. Pat's is going to do a better job than me of talking about what this really feels like, because St. Pat's uses it every day, but I'll do my kind of best here. So if we think about your EMR, inside of your emergency room, there usually is a trackboard or a grease board function. We work with a lot of Epic shops, Cerner, Meditech. So we probably work with every single vendor that you guys have in the Montana community. As soon as the nursing staff or the triage staff arrive the patient or a tech and enters information into the EMR, again, this is all native to the ED's workflow: first name, last name, date of birth, social, if they'll give it, address, phone number, chief complaint. Those things are entered into the system, and usually that means that the patient has now been arrived at your emergency room. As soon as that arrival occurs, an ADT message is sent saying, what else do you know about this individual that might be helpful? And very quickly, what comes back into the EMR is a little alert, which you can see here. We give you lots of examples, but we've seen many hospitals come up whichever alert is best for them. Again, that's integrated straight into the trackboard. And then they can click on that, and what opens is what's often referred to as an ED notification or an Edu report. And this is that single, succinct, action-oriented summary for the ED provider to be aware of as they move through assessment, triage, and plan. Right off at the top is, as I mentioned, any history in the last 18 months of aggressive or concerning behavior towards staff, bringing in of illicit material, coming in armed, or being aggressive either verbally or physically. The next section is if the patient is attributed to any case management programs in the community where they are actually putting care recommendations into our system. And these can be created by an emergency room or somewhere on the network. If the patient is being managed by a care manager in Washington, they may have created a care insight that would populate here. These are intended to be short, specific, and succinct suggestions to an ED provider of how to engage and support and care for a patient who they may only be seeing for their, just through point of care, where someone else has a longitudinal relationship with that individual. That can be supported by other care history that is relevant to the patient's background that might not be immediately apparent upon arrival for the chief complaint in which they are describing and experiencing at that moment. Then quantitative and qualitative information about the patient's ED utilization history from all across the collective network of hospitals and skilled nursing facilities. And for emergency room physicians, we just show the last 6 months of where they have been, what state that was in, what was the encounter type of inpatient or emergency room or skilled nursing, what was their chief complaint and admitting diagnosis and discharge diagnosis, and then what was their discharge disposition. And this really helps the emergency room provider understand, where has this patient been before they got here, and can I help them then connect back with services that are better appropriate and going to better serve their overall needs, kind of to what Chris was describing with the EMS program and clinics. And then anyone who's attributed to the patient from a care provider outpatient perspective that has been sent to us through a variety of sources. That could be through a health plan source or a clinic source. Like I mentioned, we also integrate with state PDMP registries. This again is not functionality that is turned on in Montana today, but it is available in other communities that we work with across the US. I like to keep this demo really short and sweet. But that is the ED notification. Again, it is intended to support the work that Big Sky Care Connect is doing and offer everybody a nice integration into your EMR that allows you to understand what is relevant to the patient that is here today that I need to keep in mind. We also are working with public health sources in other states to share COVID-19 information, which can really help with addressing how patients are experiencing the pandemic.
Great, thank you, Rachel. Does anyone have any questions?
And I'll mention that I did not go through the case management workflow. I really want Holly to speak to that from the ED case management perspective. That is also a part of our workflow, but I was really going to focus on the ED physician experience. So I could do a warm handoff.
Great, well, we will turn it over to you, Holly.
Okay, so I'm Holly. I work at St. Patrick Hospital in Missoula, and we've been using Edu for, I want to say, 3.5 years. So it's well established for our hospital. And as you know, Rachel talked about, there is a lot of different functionality for Edu, and I can only talk to a narrow window of it. But for my work, I use Edu to really focus our efforts on caring for patients who are particularly socially vulnerable. So that can be people who are homeless or have unstable housing, as well as people who have complex medical issues combined with kind of the socially vulnerable status. And so when we have a person who's identified as belonging to one of those groups, typically we have some guidance that goes along with the best way to approach that person's care when they present to the emergency department. Often that can be as simple as the name and contact information for that person's case manager at a partner organization. Another example, I really rely on, once I flag a person, I've got my own little tag in there. I receive an email when basically the minute that person gives their name at the ED triage desk. I'm not in the main hospital building, but I know as soon as one of these people does present to the ED, it gives me an opportunity, you know, assuming that I am able to open that email right then. But I see that name. If there's something that's very timely and needing action ASAP, that gives me an opportunity to let the ED social worker know the person needs action. You know, they can see the information that I've entered in EDI from their access to our EMR, but it's just never quite the same as an email or a phone call prompting what needs to be done. So an example might be we have a non-congregate shelter set up in Missoula, and we have groups of people who are homeless who are identified as being the most vulnerable, generally people who are older and with medical issues. And they're homeless, so they're not necessarily easy to reach by phone. And it's a lot of catch as catch can for people in the community who are doing a lot of street outreach. But with EDI, I'm able to enter a note that that person is eligible and prioritized for the non-congregate shelter. And if they present to the emergency room, to reach out to that shelter coordinator. And so that gives an opportunity to cut days or weeks out of the process of connecting that person with that resource, when otherwise it would truly just be by chance that someone catches them and runs into them and lets them know. I mean, it's still by chance if they get to the ER when that's still a time-sensitive issue, but it's a lot better than not having that opportunity at all. We also have in Missoula, we've got some good resources for these communities in Missoula, including like a mental health crisis outreach and resource coordinator. So when we have patients who are hitting the ED often because they're homeless and in mental health crisis, I can include that coordinator's contact information for that ED staff to consider calling her while that person is still in the ED, assuming that they don't quite reach the level of needing inpatient admission. They might not need to meet with have a mental health eval while they're there in the ED, but clearly they need services and they're not getting them. So just another example of how having that information available when someone presents to the emergency room gives our staff at St. Pat's just a few more options for what treatment to suggest and how to discharge plan for that person. Another, aside from that care coordination notes and that alert process being useful, I also use the reports that are built in EDI to review the prior day of people who have had 5 or more ED visits, 3 or more facilities in 90 days, those kind of alerts. And that gives me a chance to see if there's someone who to use the phrase rising risk again, who looks like they've got some concerning issues and they haven't yet reached the level of having care coordinated by any of the groups I work with, but that gives us a chance to say, we think this person's going to need more and soon, and what might that be, rather than waiting until, you know, it's the 5th ED visit instead of the 25th. So those reports are useful for that work as well. Does anyone have any questions about my angle on how EDI helps that kind of work?
Holly, this is Rachel. Just a little bit of a question for you. We often hear that it can be tough for the ED case management staff to kind of figure out how to get this into daily work. How did you start to make this a part of daily work for you?
Well, I like I said, I don't do patient care, and I'm in a different office, and so my work with it is really about what I'm inputting into the system. I'm not, aside from the alerts of when someone does present, I'm not, from our EMR, I'm not the one who's going in to find the information. But there is I don't have a good answer for that, because I'm not the one, pulling up a patient whose name I'm not familiar with and scanning the record at the beginning of care. I do know that it's the little brief notes are integrated into kind of a snapshot view, I think is what it's called, when someone does present to the emergency room. And so that's where I suspect our staff is getting the information I put in, rather than them like actively clicking into EDI, to the web-based module to review the information. But I think there might be other ways that information from EDI is communicated back to our staff. I know that it's set up so that our security office gets just hard copy faxes anytime someone presents who has one of those security flags on their record, and that's kind of the security office's version of my email prompt to let them know there's someone in the ED who's going to need a little bit of a different attention.
Holly, one question that we often get from facilities is, what is the most important feature used with connect facilities with EDI alerts, and how user-friendly is the program for you guys?
So for me, to answer the second question first, for me, it's very user-friendly. Aside from when I, initially enter that MRN to pull that patient up in EDI so I can enter whatever care coordination information I have, I'm not having to click around within that patient record. It's just all that front page, and I scroll down to the little care coordination box and type it up, save it. So that's not, for me, it's not time consuming. It's, nothing like our EMR Epic as far as the number of places you need to go to get, that person's complete medical record. And then the first question you asked was,
what's the most important feature used when you connect with those alerts?
I would say sharing that community-based care information, so case management, as well as other resources that person who is not likely to be seeking resources on their own. They're maybe not likely to call whatever is put on their AVS, their after visit summary, but to have the real-time recommendation or coordination information of who staff should call or might want to call while that person is right there in front of them.
Great, thank you. Rachel, a question for you. Could you talk about some other ways that facilities, the ease of connecting other facilities with this?
Yeah, Collective has an implementation team, and we have a dedicated Montana application team ready to do the integration with Big Sky Care Connect and then the deployment with your EHR team. Generally speaking, those projects take about 12 weeks, depending on how quickly we get a contact at your EMR team. St. Pat's probably hit about that timeline. I worked with a lot of the Providence IT folks. Once we get it connected on the technology side, we will provide the staff, the ED staff, with training, and we will show them how to write an insight. So it's very easy. And then, as Holly was mentioning, she was really speaking to the portal training, and we will train the ED case managers on use of the portal and writing a good care insight. And as Holly was speaking, I brought up just what that experience is like. So you should be able to see on the screen right now, as Holly mentioned, it is not as robust as a full EMR. It's intended to be a very easy to kind of get started and learn how to scroll down from a patient page to ED history to writing a care guideline. And as you can see here, they're very short. So what we have found is that staff comfort and training is very light. Bailey will spend about 45 minutes with the ED clinical staff, definitely the ED case managers, and then they're usually off and running, and then we'll provide them with support. So, and then once you have your ED notification integrated into your EMR and your ED case management staff are trained, they will automatically see all of the encounter visits from all across our network across the US. They don't have to do anything to see those visits. It's a part of deployment of the notification in their EMR and training the ED staff. Does that help?
Yes, ma'am. Thank you. Are there any other questions for our speakers?
Kelly, I have a question. This is Jeanette. Holly, thank you so much. In speaking with you, I have started to realize that this module can not only help when the patient's there in the emergency department, but you also have a way now of managing these really vulnerable and high-risk patients through this module on an ongoing basis. So I think that's a very, very powerful, simple tool for that feature. When we spoke with you last week, Mary had talked about some work that you guys are doing with PAC teams for behavioral health. Can you speak to that at all?
Yes, so we're in the early phases of within the Missoula community expanding the provider organizations that participate in EDI. And so, for example, Western Montana Mental Health Center has our PACT program, which manages people who have severe and disabling mental illness and need essentially lifelong case management. And so once that PACT program is live on that, they'll also, the care recommendations and care coordination that they're going to be able to enter into a patient record is going to be a lot better than what I'm going to, I glean information from case conferencing, and then, someone might give me more details in a one-off instance of someone we're all really worried about. But I think it's 70 patients, 70 people in the community who are part of the PACT program. So for those 70 people, Western Montana Mental Health will be able to include some much more robust information about that patient's care plan. And I'm really encouraged by the fact that other organizations in the community are joining this, because it just makes it all so much, it's like this exponential improvement to what information's available to coordinate care, more than just me, one person, entering pertinent, relevant information, but it's just not the same as those partner organizations adding input, and then also them being able to see that their patient presented to the ED 3 times over the weekend, and that person needs a little bit of follow-up as soon as their staff can get to it. It all builds on what's already there, the more organizations that are able to use it, and then it becomes more and more relevant and feeds into people being invested in checking the notes, and when they know that there's going to be something relevant there for that patient's care.
Thank you.
Thank you. Any other questions? Well, I would like to leave you with a thank you to our speakers, especially for sharing all of your information, and thank everyone for spending your lunchtime with us today. We would love to share more information about how Big Sky Care Connect is harnessing the power of healthcare information to create healthy Montana communities. Please feel free to reach out to us at any of the contact information listed here. We have our outreach coordinators standing by that would love to discuss any of this with you.